Hello, everyone. My name is Rachel, and I work at the Brookfield Library. Thank you for joining us this evening for our program, COVID-19 Vaccines in Brookfield, a conversation with Maureen Farrell. Hello, everyone. My name is Rachel, and I work at the Brookfield. Based on the number of people who signed up for this program and the number of questions that I received for Maureen, I know that there's a great desire for more information about the vaccines. So I'm so pleased that Maureen agreed to speak with us this evening. The coronavirus vaccine rollout has been confusing, and the information changes due to it being such a fluid situation. Just to illustrate quickly, the New York Times had these headlines from around 7 a.m. this morning. As eligibility for coronavirus vaccines expands in US, so does confusion. And demand has far outweighed supply, leading to overwhelmed public health departments. I'm sure Maureen can attest to that. And then the Times had these headlines around 5. Biden plans big vaccine push despite limited supplies. And who gets priority? Patchwork US vaccination policies create uncertainty. So that about sums it up. In Brookfield, the first selectman sent out new vaccine guidance just today. And I hope everyone is aware of that and has access to it. The information we're sharing this evening is up to date, but vaccine information is subject to change, and we will surely change. It will surely change over the coming weeks and months. So please bear that in mind, and always look at the town website for the latest guidance. They update their FAQs all the time, and Maureen will share more sources for up-to-date information. So I want to thank Maureen Farrell for her willingness to speak with us tonight, and she is dealing with a lot over at the health department. I'd also like to thank all of you who took time to send in a question. They were all reviewed, and many of them will be asked, and many others have been incorporated into the discussion that Maureen and I will have this evening. So without further ado, Maureen, please go ahead, tell us about yourself and what you're doing for the Brookfield Health Department.
Well, first, I'd like to thank both Yvonne and you, Rachel, for inviting me to come and speak tonight during this meeting. And I also want to thank all the people that joined the call tonight, so that hopefully I'm able to share some information that sheds some light on all the news that keeps circulating around and confusing everyone. And I'm going to try my best to answer as many questions as I can, and any questions that I can't answer tonight, I certainly will make sure they get answered and put on our FAQs, frequently asked questions, on our town website. So just to give you a little bit about my background, I've been a Brookfield resident since 1985. And I moved here with my husband and had my 4 children, raised them here in Brookfield Public Schools. And my first degree is in nutrition. I'm actually a registered dietitian. But after doing so much community work while my children were in the public schools, and then Meals on Wheels, and then eventually working for the American Red Cross, and then I kind of had this desire to go into public health. So, you know, while my kids were in high school and college, I went back to school and got my master's in public health. And really was very excited to, you know, engage in this field. And so for the last, really, I would say most of my career, I have like 20 years of experience of doing community work. And in the last 10 years, that community work has been in chronic disease prevention, as well as community wellness. And I've, you know, had the pleasure, Dr. Sullivan asked me to join the Brookfield Health Department in October to help him with some special projects for the health department. And Dr. Sullivan has been our fearless leader in Brookfield for the last 10 years. And I have actually worked with Dr. Sullivan on projects in my other jobs and roles that I had in the community. So I have 10 years of work experience with Dr. Sullivan. So when he asked me to come on board with the health department in October, I was more than willing to help with the projects that were necessary to help our community you know, be safe and move forward as we get through this coronavirus pandemic. And so the 2 projects that I'm working on for the town of Brookfield, the first one is the contact tracing program, which I have some fearless volunteers that have worked so hard over the last, that program rolled out in May, and they have been working so hard to do outreach and support for members of our Brookfield community who have tested positive for the COVID-19 virus, helped to supply resources, information, and how to keep their family safe. My volunteers, some of them are nurses. We have people in community wellness. We have just 6 really dedicated volunteers that I tip my hat to, because they have really had to come on board and just learn what needed to be done, and they have been really helping our community get through some of this pandemic. The second project that I'm working on for the town of Brookfield is the vaccine rollout program. And I know that that's why all of you joined the call today. And so what I wanted to mention is that this pandemic is really, when you really think about it, to address this pandemic, we have to address it in 3 ways, right? So we have healthcare, right? So, we get sick, we have healthcare. And so our healthcare organizations and healthcare entities, doctors, nurses, they had been working round the clock on this pandemic. Many Brookfield residents are helping to support this effort in the healthcare field to get people healthy. And healthcare is really important, and they've learned so much since March that there's so many more things available to us in the community if we are dealing with the COVID-19 virus. So our healthcare professionals are one important arm of this battle that we have against COVID-19. The second one is prevention, right? And it's public health and prevention, and that's where the whole idea of wear a mask when you're in public, wash your hands frequently, maintain social distance, really monitor this, how many households you're mixing. You want to try to stay within your own nucleus household. And many of us, especially if you're in my age category, have children that live in other households. And yes, they're part of my main family, but they live in other households. And so if you mix households, you risk spreading the virus to households. So that's an important concept. So we have healthcare, we have prevention or public health, and vaccines fall under public health. Vaccines definitely, that's part of the public health role, and that's why we are rolling out these vaccines. And yes, it seems a little confusing, but it will get better over time. So please be patient. And then the third part of this battling the COVID-19 virus is really the community. How we work together as a community so that we can battle this virus together and move forward with both keeping our businesses open, making sure that there's childcare for people who need to work. It's about people being able to live a normal social life. I mean, many of us are feeling that isolation, that feeling that we can't connect with one another in a face-to-face way. And in order for us to get past that, we need to work together as a community and really, pay attention to the important role that the public health measures are asking us to do. And the vaccine is going to help us. And so I know that's why you're on the call. So I don't want to spend too much time on those 3 arms, but I felt it was important to say that, there are 3 arms of battling this virus, and all of you are part of that.
Okay, thank you. Sorry. Okay, so I have prepared a series of questions that I would like to ask Maureen, and hopefully that will give us a better picture of the vaccine rollout. Okay, so what I'll do first, I'll ask some general questions, and then I will get to some of the specific questions that were submitted by residents. So the first category of question I want to talk about is safety, and for a number of different reasons. There are people who have concerns about the safety of the vaccines. So are the vaccines safe?
Okay, so these vaccines have what's called an emergency authorization approval by the FDA. So it's because of this, because we're in the middle of a pandemic, the authorization that they have granted approval for these vaccines, it's called an emergency use authorization, so that these vaccines can be used. It's really important. Like all vaccines, the COVID-19 vaccines are called messenger RNA vaccines, and you may have heard this. Dr. Fauci has spoken a lot about these messenger RNA vaccines. They might also be abbreviated mRNA vaccines. These are the Moderna vaccine and the Pfizer vaccine are two of the first COVID vaccines that have been authorized for use in the United States. Some key points that I want you to know about the vaccines is like all vaccines, the COVID-19 mRNA vaccines have been rigorously tested for safety before being authorized for use in the United States. The technology is new, but it's not unknown. They've been studied for more than a decade. I don't know if many of you recall, but about 10 years ago, we had an outbreak of the H1N1 flu virus, and there was an emergency response to that flu virus. And it was after that H1N1 emergency response that this new technology, they started studying some of this new technology. And so it has been studied and researched for more than a decade. These mRNA vaccines do not contain any live virus, and they do not carry a risk of causing disease in the person who receives a vaccination. The mRNA from the vaccine never enters the nucleus of the cell, and it does not affect, nor does it interact with a person's DNA. And, one of the, like all of you, I've spent a lot of time listening to what some of the scientists like Dr. Fauci have explained around these vaccines. And actually, I saw a really wonderful Facebook interview of Dr. Fauci on the vaccines, and I'm sure you can find it if any of you are on Facebook. And it's an hour-long program about COVID-19, this next part of this pandemic, and then he spends about 30 minutes talking on these vaccines. Okay.
Thank you. I do also want to say that the FDA makes all safety data publicly available. It's a transparent process. And if anyone is interested in looking at that information, they can call the library and a librarian can help them find that information if they'd like to. So, but everything is open.
In addition, when you go to receive a vaccine, whether it's the Pfizer vaccine or the Moderna vaccine, you're going to get, we are required to provide you the emergency use authorization, the EUA of the vaccine that you received. And it will have all the facts about that vaccine. And if any of you want to look it up beforehand, you just probably have to put in your Google search, emergency use authorization of Moderna or emergency use authorization of Pfizer. And I'm sure that, you would get the fact, you probably would be able to get some of those fact sheets, but this is what you'll get at a vaccine clinic, which talks about the vaccine that you're getting.
Thank you. Okay, so the next topic that I'd like to cover is who gets the vaccine. So who has created the criteria for receiving the vaccine? Is it correct that it's decided at the state level, since there's so much variation by state? And then who at the state level is making those recommendations to the governor? And then are those rules being adopted by states based on CDC guidance?
Right, well, thank you. I'm going to share my screen if I can. Yep, I'm going to share my screen. This is what I want. Oh, here it is. Okay, share my screen. And what you can see here, this is the COVID vaccine in Connecticut. This actually went live yesterday. I received a memo from the Connecticut DPH. I think maybe actually it was Wednesday night, because we knew that the 75 and older was being announced yesterday at noon, that we could upload vaccine recipients who met the category of being 75 years or older into the VAM CDC portal, which I hope we'll get into a little bit more detail. But what I want to show you is that these are the phases of the vaccine rollout in Connecticut. And yes, it is confusing because if you listen to the media, if you're on the New York station, they're saying one thing. If you're on the Connecticut station, you might, and it's a local station, they might be saying something else. But we as a health department need to follow the guidance that's from the state of Connecticut. And Dr. Sullivan, who's our fearless leader, has been on the committee at the state level advocating for the different priority groups to make sure that individuals who are most at risk have access to the vaccine, because right now the masses of the vaccine is being produced. And while those masses are being produced, we need to start with some of those groups that we know are at highest risk. And so yesterday at noon was the day that anyone who was 75 or older, according to the rollout at the state of Connecticut, is called phase 1B. Now, prior to that, which started about mid-December, we had phase 1A. And you can see from the screen that I've shared here that phase 1A was healthcare personnel. So let's just face it, we had a lot of healthcare nurses and doctors that were in the trenches working with people round the clock, and needed to have that vaccine as soon as it became available. And so it was a high priority to get our healthcare personnel vaccinated. Our long-term care facility residents, you only had to watch a few news programs early on in March to know how the impact the COVID-19 vaccine had on our residents in assisted living and long-term care facilities. And so they became a high priority in phase 1A. And then, of course, our medical first responders. If you're at home and you have COVID and you have a complication of COVID that requires you to go to the hospital, well, who's taking you there? It's our emergency medical responders. The police are responding, the EMTs are responding, and so they're at risk as well because they're taking people out of their homes who are sick with COVID. So that's why they were chosen to be in phase 1A. Now, yesterday at noon, phase 1B rolled out, and those were our individuals 75 or older. I want to just take you back to March and all the things that we all learned since March, and we all had to have this learning curve, right? We had to, in March, all of a sudden we had to do telehealth. That was like a whole new learning curve. I don't know how many of you, but I had to have a student intern work with me on how to use Zoom. So that was a learning curve for me. I had to work with somebody who was younger than me, that knew that technology really well, who could teach me the technology of Zoom. So that was a new technology. So this access to these vaccines has a technology component to it that is really, to someone who's 75 or older, very challenging. And not only that, we know that individuals who are 75 or older, they may have more underlying chronic conditions, which might predispose them to having more complications from COVID. And so therefore they were put in the 75 and older category because there's limited amount of vaccine. And if they don't have the ability to do the technology or the time to learn it or to find someone to help them do it, then that becomes a challenge for them. And then if we were to roll other people that were younger than them that had technology skills, they would take up all the appointments. And now our 75-year-olds or 80-year-olds or 98-year-olds, we have people that are 100 years old here in Brookfield. They need to have that vaccine first. So that's why they're in phase 1B. Now, you can notice here, scheduling soon is going to be our frontline essential workers, individuals and staff in congregate settings, individuals between the ages of 65 and 74, and then individuals between the ages of 16 and 64 with comorbidities. So, and eventually, all of these like special, priority groups, as they have access to the vaccine, it will, and by the spring and summer, the vaccine supply will be greater, and then there will be multiple places where people can get their vaccines. So this is easy to get to. You could just put in your search engine, whatever search engine you use, just put COVID-19 vaccine in Connecticut. And there are links on this website that you can click through and learn more information and stay up to date. You can go up and bookmark it, and that way you know that you have it in your saved places. You can bookmark it.
I actually have a couple of questions about this. First off, for the phase 1A, have all of those people who qualify under phase 1A, have they all received their first dose, and have they received their second dose?
So I believe that everybody who in Connecticut, at least I can only really, maybe speak for our, greater Danbury area and, what I hear about what's happening in Connecticut. But the phase 1A started sometime in mid-December. And since the vaccine is 2 doses and they're about a month apart, the 2 doses, Moderna being 28 days apart from first dose to second dose, and Pfizer being 24 days from first dose to second dose. Some of our healthcare professionals have gotten both doses, or they have their second dose now scheduled. And so I think we're close to getting those 2 doses for our healthcare personnel and probably our medical first responders. Because if they started in mid-December, they can start making their second appointments now. It's practically mid-January. It is mid-January, it's the 15th.
When can we expect to hear, when the scheduling is phase 1B, the scheduling soon part, which I know is probably an unanswerable question, but I want to pose it anyway. And then 2, when can we expect to hear who is included in phase 1C?
Well, I think if you want it, the first place to go, if you want to keep up to date with when these announcements are made, is to bookmark this page, because this is where they're going to be uploading it. And so this is on the Connecticut Department of Public Health website, and you can find it. You can find it by just using your search engine. COVID-19 vaccine in Connecticut. They're not really giving us firm. They're not giving us firm dates. As you can see, that what they're saying is scheduling soon. I think they want to see how the rollout of the phase 1B goes before they make a commitment as to when the next phase will occur. But I think from what I've heard, and when I go on programs and webinars when they're talking about the vaccines, I think the goal is to have everyone who wants a vaccine get a vaccine, by the summertime. So I think the 1C could be sometime in, April, May, but I really can't say. It's like a guessing game right now, because we have to see how each different. But what I will say is that what the public health department will do in Brookfield is we will keep our FAQs up to date, and we will post information as we get it, on our town website. So if you check back frequently, you can get more information by checking our town website, or go straight to the Connecticut Department of Public Health and, follow this link.
Now, can you tell us, is there something after phase 1C, or are we thinking now that phase 1C is everyone else?
I think phase 1C is going to be everyone else. But, as you can see, they're not making a commitment.
Sure.
So that allocation committee has been meeting, I believe, since the summertime to try and, and it's a diverse committee that, is all different groups. Dr. Sullivan is represented in that group, because Dr. Sullivan is both a physician and a public health professional. So he is in that group. And so he's been working tirelessly with other members of that committee. And, they all have to come to a consensus.
Let's talk for a moment about comorbidities. basically, I imagine a lot of people on the call know what that means, but in case they don't, can you just tell us what that means? And
Sure.
also which comorbidities are considered reason to be in phase 1B versus phase 1C potentially?
Right. I'm sure that, all of us who have underlying medical conditions would like to be, I mean, it's urgent, it's important for any one person if you're dealing with another chronic disease to that it's a priority that you get a vaccine. And we are working tirelessly to try to get those vaccines to people. In our frequently asked questions, which is on our website, we did answer that question briefly. So and this actually came from the Allocation Committee last week. So immune compromised conditions, and this is based on the advisory board to the Connecticut Department of Public Health. It's those that are suffering from cancer and are undergoing treatments, chronic kidney disease, also people who have organ transplants and are on immunosuppressive medication in order to stay healthy. People with COPD, that's chronic obstructive pulmonary disease. Obviously, COVID affects the lungs, so people with COPD would be an underlying chronic condition. Heart conditions like cardiomyopathy or heart failure or severe coronary artery disease. I mentioned the solid organ transplant. Obesity is a risk factor with COVID-19, but unfortunately, 60% of adults in our country are overweight or obese, and 35% are obese, meet that criteria of obesity. So that's a very, very large population group. And so while it is an underlying comorbidity and risk factor if you were to get COVID-19, it's also a very large population group, large in meaning number of people. People with underlying disease like type 2 diabetes, right? That's another one. Type 1 and type 2 diabetes are chronic conditions. So they would, so they are, they're in a group that's immune compromised, but we don't really know yet how that's going to affect the different phases. Because some of these individuals are also 65, between the ages of 65 and 74, so they might meet two criteria.
The next question that I have is, how are people going to need to prove that they have a comorbidity or underlying condition when they sign up, when they go to the vaccination site? Are they bringing medical confirmation of these underlying conditions? I mean, how is that being vetted?
As a wife of a local physician in the community, just imagine if everybody with a chronic underlying condition had to have that signed off by their doctor. So that would create another barrier to vaccination. But you will be required to sign an attestation. You're gonna sign and say, I meet the criteria for this phase, and if you're found that you've lied, then there would be a punishment, associated with that, a fine associated with that. So, for an example, a 40-year-old shouldn't be walking into a clinic in phase 1B with an appointment, because that would be easily just, somebody who's 40 compared to somebody who's 75 or older, right? Unless they were still somebody in phase 1A, that was a healthcare personnel, that would, you would have to sign and prove and just verify that, yes, I do meet this criteria.
Okay. Are there any groups? Actually, you can stop sharing your screen if you want, so people can see you better.
Oh.
You're just going to be a tiny little square.
Thank you for mentioning that.
Sure. Are there any groups that should not get the vaccine at this time? What is the guidance, for example, for people who have had COVID-19 already? Um, what about those people who have received certain treatments for COVID-19? And then the other category would be, children under 18, and then people with the history of severe allergic reactions. What is the guidance for these categories of people?
Okay. All right. Let's first start with people who have had COVID-19. Should you get the vaccine? So the recommendations from the public health leaders is that yes, you should get the vaccine, but not while you're actively sick, right? So, you've had COVID-19, you've recovered from COVID-19. Typically, a typical course of the virus might be 10 to 14 days, where you feel better. So, we would recommend that, that you wait a little bit of time after you've recovered to get the vaccine, and know that when you have COVID-19, there is some natural immunity. It's not 100% effective, and they don't know at this point how long that natural immunity will last after you've been sick with the virus. They've been studying people who got sick, but people only started getting sick with the virus in like March. So there's the research isn't that old yet. So they don't really know how long natural immunity lasts. So yes, if you've had COVID-19, once you're healthy, it is recommended that you get a COVID-19 vaccine. It's also recommended that you have the flu vaccine, when you're healthy, that you have the flu vaccine, because it's the middle of winter. And just imagine if we have COVID and flu, hitting all at the same time, right? The next group that you asked, well, what about if I had COVID-19 and I was hospitalized and I had to have certain treatments? Back in March, we didn't have a lot of the treatments that we have now. And it's pretty amazing what, how quickly the medical profession was able to, and the pharmaceutical researchers, how they were able to develop drugs and treatments that can at least improve the course of the vaccine. Unfortunately, not for everyone, because we still have, 4,000 or 5,000 people dying every day. But there are still treatments, and those treatments have some, they're building some autoimmune, they're building a response to the virus. And so that if you've been hospitalized with COVID-19, the recommendation is that you check with your doctor before obtaining your vaccine, because the doctor might want you to wait 90 days or so until all of those treatments that you were given are no longer in your system. And then what was the next group? Those individuals who have allergic reactions.
And children, okay. And then okay. Allergic reactions. Yes.
So let's do allergic reactions. For people who have severe allergic reactions, again, the advice is to first talk with your personal physician if you're someone who has severe allergies as to whether or not you should, seek a COVID-19 vaccine. And secondly, if you had a bad reaction to the first dose of the COVID-19 vaccine, then that might preclude you from getting a second dose. But for the most part, people with severe allergies, you need to check with your doctor as to whether or not it would be appropriate to get a vaccine. Because there are, maybe there's a particular ingredient in the vaccine that you're sensitive to, and you would have to work that out with your doctor.
I actually want to pause for 1 second here. And there was a question from someone, a resident, that I would have saved for the end, but I just want to ask it here since we're on this topic. And that was, when the vaccines are being administered, will there be anything in place for monitoring those people who do have a history of severe allergic reactions, so that they'll feel, are they just sent home, or will they be able to, there is someone there to monitor those specific people?
Yes. So the answer is yes. After your vaccine, you're going to be expected to be socially distant, but monitored in a location for 15 minutes. If you have a history of allergic reactions, but the doctor still felt it was, that a vaccine was still worthwhile for you to, seek out, then we might ask you to wait 30 minutes and monitor for 30 minutes after the administration of the vaccine. You will have a medical screening question before you get administered the vaccine, and you can discuss some of your questions with the nurse, before you get your vaccine. And then following that, there is a space, like I said, it'll be socially distant where you will monitor. It's self-monitoring. We'll trust that you know how to turn your timer on your phone or look at the clock and monitor for 15 minutes. But we'll have somebody there in the room that's at least overseeing, making sure people are doing the monitoring. And if you decide you don't want to monitor, then we're going to ask you to sign a release that you don't want to monitor. But it is important to monitor for those 15 minutes. We do have, emergency response kits like EpiPens and the medicine that would needed to respond to if there was an adverse reaction. And fortunately for us here in Brookfield, we have a number of retired physicians who are volunteering in our vaccination program. So I want to be able to talk about that. I can't wait to tell you about what a great response that we have had from the Brookfield community to this vaccination effort.
Wonderful. We will talk about that.
Oh, and also too, and I just want to add one more thing. In addition to that, our EMT, we have a great EMT program here in Brookfield. They will know when our vaccine clinics are, so that they could be ready and alert if there was something that was necessary.
Wonderful. And then just for our last thing before we get to the part that I know people really want to talk about, which is the signing up process and then the administration of the vaccine.
All the fun
and
stuff.
It's very nice to sit through 40 minutes of other things before getting to the thing they really want to hear. But the last thing is just if you could just quickly talk about the lower age limit for the vaccines. Is it 16 or 18 is one vaccine?
So I know the Moderna vaccine, the emergency use authorization response says it's 18. You have to be 18 years or older to get the Moderna vaccine. The Pfizer vaccine may be 16 years of age or older. So our very young children at this point in time, they're not recommended. Well, they haven't said whether or not they will get vaccines. I think they're still making that determination.
Okay, thank you.
Mm-hmm.
Okay, so the big stuff, signing up. And I know it may be that a lot of people who are listening tonight have in fact signed up now since they opened up yesterday to the over 75. But certainly a lot of people have not signed up through VAMS yet. They've signed up perhaps through the town, or they don't know where to sign up. So basically we'll just cover the whole thing if that's okay. Mm-hmm. And basically, so my question first is, who signs up now and where do they sign up?
Okay. So when we knew that we were going to have this priority process in place for the vaccine, and so back, I want to say it was early December, the first selectman put in his town code, red code alert. Hopefully people are getting that red code alert, and he put in there, if you're 65 or older or have any type of underlying chronic conditions, go on the town website and sign up. So there is a seamless doc on the town website. Let me see if I can, well, let me just talk about it first. I mean, you go to Brookfield, Connecticut town website, the town website. You can't miss it now because we have a red banner on every page you're going on. You cannot miss, that. Now, when you go onto the town website, we have a seamless document. And what you're really doing on that website is you're saying, okay, I'm signing on here because I'm interested in getting an appointment for the vaccine. Okay, so when you go on the town website, that does not mean you have an appointment. It just means you're telling us at the health department that you're interested in getting an appointment. And we decided back in December that it was important to try to work ahead because, as you know, everything happens in 24 hours. So we had decided to work ahead. And so we started collecting. we started asking anyone who is 65 or older to go on to the town website and put your name. It's called pre-registration, or the other words, I'm interested in getting a vaccine appointment. And so I have to say, we have more than 2,000 people that have actually put their name in the seamless document on the town website that are over 65. I'm really proud of that number because when I look at population data for our town is 17,000 people. Of those 17,000 people, 3,200 of them are seniors over the age of 60. I shouldn't say seniors, older adults, because I'm one of them, over the age of 65. And I'm really proud that, so people listened and did go on and put their name and said, I'm interested in a vaccine. And I'm over the age of 65. And then some people also completed that document because they had underlying chronic conditions that they wanted to be on that list as well. And so we have the ability to sort that list for the different priority groups. So over 75.
I just want to ask you quickly, just I don't mean to interrupt the flow of what you're saying, but I did have a number of questions that seemed to indicate that people had signed up there and hadn't received any confirmation that they had signed up. When they sign up there, should they have received a confirmation email or?
So that was an afterthought, and that's probably, we didn't think about this ahead of time. We put the seamless document up, and it would have been nice if right from the very beginning, people who had done that had gotten a reply. This is a learning curve, and we're not perfect. We tried our best. When we realized that by not having a reply, the health department was getting flooded with phone calls and people were putting their names in 2, 3, 4 times, we did finally realize that we have to have a reply to the seamless doc so people know that their name is in the portal. What I can tell you is that if you actually went to the website and entered your information, your name is there. If you went to the website 2 times, your name is there twice. If you went to the website 3 times, your name is there 3 times. So as many times as you went and entered your name, we're cleaning up that data now. Okay, so, and we, like I said, we did learn, and now after, I think beginning maybe last week or this week, you get, I think it was last week, you get a confirmation reply that we have it. We know you're interested.
Okay, thank you. So I think you are still talking about the sign up process.
Okay, so we were waiting with bated breath. When is this 1B going to happen? Like first it was, when is 1A going to happen, right? And who are all these healthcare? When is 1B going to happen? That's what's going on this week. We didn't know whether we were going to be able to load people in on Monday or Tuesday or Wednesday or Thursday, but we were told that we had to wait for an announcement from Governor Lamont. So we had been busy preparing our lists. And one of the hiccups that we realized, again, we are learning as we go. We realized that we should have required people, each individual name have a unique email. So we have husband and wives that signed up with the same email. That has created definitely a barrier for us to upload things right away. Because now we're having to call all of the couples and ask them, could you please provide a second email for one of you? And fortunately for us here in Brookfield, I've had volunteers calling nonstop, and we'll be calling some of these older adults in the next few days. We're trying to go through alphabetically the names, and trying to adjust for those. And then as we get a batch of them, we're uploading them into the VAMS appointment. So there was a little hiccup there. So some of you might be receiving phone calls from the health department or from a volunteer at the Brookfield Senior Center. And not to forget the fact that the staff at the Brookfield Senior Center are 100% in this process, and they too are helping to address the issue of the need for a unique email address for each name that we enter into VAMS.
Are the people that are being called only the people who are 75 and above, or are you calling anyone 65 and above who registered?
We will be calling both. But right now, because we want to get people 75 and older into the VAMS invitation portal, we are prioritizing and calling the 75 and older first. So if you are in the 65 and older group and you now know from listening to this program that you used the same email for two people, you can go in and correct that on Seamless Docs, or you can wait for our phone call and have your second email ready. But that we'll be calling that group next. We have to get through the 75 and over group first. And I also want to point out here, and I'm going to make a community service plea. I've been working in the community now for, like I said, over 20 years, and it takes a village with the pandemic that we have going on right now. And while we have, so many older adults have had the privilege of taking computer classes in libraries and senior centers, and I know for a fact those have been occurring for the last 20 years. And that's a shout out to those instructors who worked tirelessly as a volunteer, either in the library or at a senior center or any place where computer instruction was going on, because you're probably saving a life today, because now we have older adults who know how to use a computer, and you'd be surprised how many of them can use a computer and access access the system to make an appointment. Now, that being said, people are living to be in their 90s, late 80s, 90s. Some of these individuals probably don't even own a computer. And that's where I'm asking for I'm asking people to be kind and lend a hand to their to other members in their neighborhood, in the community. If you know of a senior, an older adult who, may not be using a computer, may not even be aware that that they're eligible for a vaccine. If you know them, reach out to them and just say, hey, did you know that you're eligible for a vaccine? And have a conversation with them. And if they need assistance with making an appointment, you can help them, and you can help us help them. Okay. And some of these seniors may eventually need a ride to an appointment. Now, also too, many of our older adults have family members, and their family members, might not live in Brookfield. Their son or daughter, well, I have a son that lives in California. I have another son that lives in North Carolina. I have a daughter that lives in New Jersey. They don't live in Brookfield. But if I needed help with computer support, I can call them and say, hey, they're asking me for an email and I don't have a computer, right? Can you help me register for my appointment? Can I use your email and get registered for an appointment? Or can you make me an email? Can you create an email for me and go through the process of scheduling an appointment for me?
Oh, I actually have a question that just occurred to me. If someone, you have to use a distinct email address when you register with VAMS, right? You can't use one that's already been used. That's sort of your unique identifier.
Right.
If someone's out of state, if say your son in California, or someone has a son in California who signs them up, can the email address be the same? Or since it's on the federal level, it can't be the same anywhere?
You mean like if my son in California, well, he might have to use a different one, or he can create a free email form.
Sure. But I mean,
Right.
are those identifiers looked at on the state level?
No, they're not.
The federal level?
No, it's by the person and the name. And, you're a Brookfield resident. We know the Brookfield resident. So you're putting it on the Brookfield portal, right?
But ultimately it ends up on the VAMS portal.
Right, but somebody's email is not attached to an address. Then the person, when the person gets the email, so then the person gets the VAM invitation and it has their name, their email identifier, then they put in whatever personal information that they need to put in. We're not collecting that. That's what the VAMS portal is doing. So that way their information is protected. So
that was probably a more complicating than necessary, and I retract that question.
So let me just put it out there that if you are an older adult and you don't have a computer, but you have a child either in state, out of state, in town, or you have a grandchild in state or out of town. Your grandchildren could do this in a whip second because they're growing up with technology. So rather than get frustrated about how you can't do it, go to your family and say, this is something I need you to help me with, because getting a vaccine means I'll be able to see you again soon.
Sure.
Right?
Yeah. I did want to ask specifically about the people who don't have computers, who don't have internet access, how they'll sign up. So I know you have addressed the asking for, being a good neighbor, being a good community.
I mean, that's going to help us. That will help us. And then we are going to have to look for community stakeholders that serve these people, right? And have them help us identify who they are so that we can make sure we get them vaccinated. But, I think all of us here in Brookfield have a neighbor that we can think of that we can at least give them a phone call and say, hey, I just wanted to touch base. Have you heard anything about the vaccines? Are you interested in getting a vaccine? And just have an open conversation with them, and then maybe they'll say, I'm all set. I have a computer, or my son called me and we're all set. I have an appointment tomorrow. But just making that phone call, you're being kind.
So, but is there anything that has been put in place where someone can call in, anything on the state or federal level for those people who just don't have anyone, or who just don't have that access? I mean, there are going to be people who fall through the cracks.
Right.
So is there anything?
Let me share my screen, and I'm going to bring something up here. This one. Okay. So if someone is living alone, they don't have a computer, maybe they don't have loved ones that they can count on, there is a COVID vaccine appointment assistant line. And the reason why I posted this up here is because rather than me spitting it out, you can actually see it. But the number is 877-918-2224. This phone system was created by the Department of Public Health and the United Way of Connecticut. So it is tied to their 211 initiative, the United Way 211 initiative. And it's specifically targeted to provide support for eligible vaccine recipients who have limited technology access, who have a language barrier, they have a disability or other barriers that could prevent them from using the existing self-scheduling options. They'll take calls from Monday through Friday from 8 to 4:30. And they do have a callback option. So you can leave a message and they'll call you back. Now, I am going to tell you that if you tried to call that number today, I'm sure there was a long wait line, because I think today was day one of rolling out the 75 and over. So I heard it on the radio this morning, coming back from my workout. And I heard it on the radio, and I was like trying to memorize the number. And then one of my colleagues in the health department actually saw it on the news and took a picture of it, and that web link that I showed you before, this one, they actually have another place. So if you do this is really copying what we've already done in Brookfield. So we've already done this step in Brookfield with people who are 65 and over. But if you haven't done it, you can click this, and you can get your vaccine answers now. And there is a link through here where you can also, tell them, I'm interested in getting a vaccine. Right.
Maureen, I'm sorry to interrupt you, but the screen didn't change, so it's still the phone number. I don't mean to interrupt, but I want to be able to see the screen.
Oh, I know it. That's interesting. New share. This one.
Maybe stop sharing and there you go.
It's interesting because this must have been a new function in Zoom, because I used to be able to just tab through. That's interesting. That's okay. So they give you some details on how to schedule, who should schedule, when to schedule, and there is a link on here too where you can tell them just the same information that we already collected at the town of Brookfield, they're collecting at the state. And I think they put that up here so that there are some towns that may not have already started their interest list, right? And so this is another place to go. But if you get, once you get a VAMS appointment, so let me just be clear what that's called. Let me see, can I do a new share?
I think stop sharing and then reshare is the best way.
Okay, so stop share. I want to show you what the VAMS portal looks like. Reshare, sorry. Which I don't see it on here, even though I have it tabbed, but it's not open in a tab. Well, I'll click here and then tab over. I think I can tab over. If I can remember. Oh, here it is, landing page. Oops. Sorry, I have all these little toolbars that are getting in the way of my links. So here's VAMS. So this is your goal, right? When you go on to either the Connecticut DPH and you fill in your name there, or you go on to the town of Brookfield, which many of you have already done, and you put in your name and your address and your telephone number and your email. The goal, when you do that, you're saying, I'm interested in getting an invitation to this vaccine administration management system, because this is the system that makes the appointment. Okay, this is the system. So when we send you, when you get in your email, once we upload it, you get an email that says CDC VAMS, register for a vaccine appointment. And then when you open it up, there's a link. And when you hit that link, it brings you to this web portal. Now, I'm already a registered user, but you would then log into VAMS and you would be using your email and you would be creating a password. So I'm going to stop a share and share something else, because this is on our town website. And unfortunately, probably got shared a few too many times today, which caused a lot of turmoil. And that was again, a learning curve for us. So please forgive us. Where did I save it? I thought it was here. All right, well, I won't share it. On our town, I thought I had it pulled up, but it's not here now on my screen. So on the town website in there, and it's also included in the in a Spotlight, Brookfield Spotlight newsletter, but it's called Steps to VAMS Appointment. And I spend some time like putting down, this is what VAMS means, Vaccination Administration Management System. The CDC is Center for Disease Control. This is what I try to put down, the definitions, and then each step is, click the blue link, it'll ask you some questions. If you're asked the question, let me get this out here right now. If you get that VAMS link and you open it, and the first question they're going to ask is, have you ever registered for a VAMS? Are you already registered for a VAMS appointment? Say no, because when you signed on to the town website, you were just telling us you were interested. You were not registered for a vaccine. So when that question comes up, have you registered for a vaccine? Say no, because we had a lot of calls today. What do I say? Yes or no? No. But if you take a look and take the time to read the steps that I typed out, you'll see I tried to be as simple as possible so that if you're not used to doing this type of thing, you can go to 1 and then go to 2 and then go to 3 and then go to 4. So you can do that. So it's on the website, and it was also included with a Brookfield Spotlight constant contact email that went out.
I would just like to say that I think that people should make use of that, because I signed my mother up yesterday and there were several questions where I thought, how am I supposed to answer this? So it's not the most, it's not the easy, like it says your employer and it auto fills in the Department of Public Health in Hartford or something. And my mother doesn't work for the Department of Public Health. in
Right.
Hartford, and I didn't, it was very,
I think
yeah,
it says I think it says your employer or organization.
right.
And
But
so so your health department, you're being registered by your health department. So in Brookfield, the Brookfield Health Department is registering you.
right.
But really, I want people to take the time to read the information we're sending you. Don't just pick up the phone and call, because most of your questions are answered in the information we're provided. And if everybody in town, all 17,000 people in town, call our part-time health department, you're going to even have the first selectman answering calls. I mean, because there's just not enough people to answer calls for 17,000 people, so please, before you make a call, please look on the website, look at the information we're providing you, click on them, so that you understand. And like I said, I did put, it's a PDF document, it's on the website, and it just goes through each step by step.
I will say there were a number of questions that I was sent, excuse me, by residents that said, what is this CDC link? I thought I registered through Brookfield. So it's definitely not clear to everyone what the relationship is between these different places where you can sign up or express
So
your interest.
let me just
So
repeat it in a different way. So if you went on to the Town of Brookfield website and you filled out a seamless doc, you told us at the health department, put me in, right? I want to get an invitation. I want to get an invitation for a vaccine. So then what we have to do with that information is we have to put that information into the vaccine administration management system called VAMS. And VAMS is operated by the Center for Disease Control, which is a federal program. So you can see that the vaccine is being produced and obviously paid for at the federal level. It's being dispersed to the states, right? The states are getting their disbursement of vaccines. And then it's the state's responsibility to decide how they're going to distribute those vaccines to their residents in their different states.
thank you for being clear about that. That's good.
I hope that was. I'm
No,
trying.
it was.
Doing my best.
There's a lot of stress around this signing up and getting the vaccine, and people have been cooped up, and it's been terrible, right? So I think there's all the other layers on top of it that make it harder to understand, and it's not that easy to understand in the first place. So
well, I feel the same isolation that I think a lot of other people are feeling, which is why I cannot wait to get this vaccine party started. I really want this vaccine out in our community. And, I want to see my grandchildren, and I don't want to have to see them outside after a snowstorm. I want to play with them, or I want to be able to, see my children, go see my new grandchild that's getting born in North Carolina, right? So we're all feeling these things. Every single one of us have personal reasons why we want this COVID pandemic to be over. But I'm going to bring it back to the 3 tiers. It's healthcare, it's public health, and it's the community. And if we don't work together as a community, it's going to be very, very difficult to tackle this pandemic.
I just want to say that it is over an hour. I mean, we sort of scheduled this to go an hour, and I think people are sticking with us.
I'm known for not liking to talk. I'm sorry.
I hope people are sticking with us. So I think that hopefully we're covering good information that people actually want. So if it's okay with you, I have a lot more questions. So.
Sure, perfectly fine.
I will just say quickly, one question I got sort of made me tear up a little, which was something along the lines of, how long after I get my vaccine can I visit my mother? She's been in a nursing home.
Exactly.
So
yeah, exactly. When are we going to get back to normal? And once you have a vaccine, it's still, it's going to take time. If you really listen to the research, they're saying that we have to have about 80 to 85% of our population vaccinated in order to really have that immunity, that immune response that we want as a community. in order for it to be, effective. And so, it's going to take us a while because the vaccines have to be produced at the federal level by all the pharmaceutical companies. They have to be dispersed to the states. The states have to get them to the local health departments, and then they have to be administered. So it's a process. And, while we're going through that process, we are going to have to continue to be vigilant about wearing masks and maintaining social distance and really trying not to let the best of COVID fatigue get to us. We have to stay the course. And I know for sure that they will tell us when it's time to, to kind of, I think the summer was kind of like a sign of what it could be like, right? When the virus there wasn't such a big uptick in the virus. We had very few cases in Brookfield, and that's what we'll eventually get to after we get everybody vaccinated, is getting back to some of that normalcy. And like I said, we want businesses to thrive, and we want people to have childcare so they can go to work, and families to be able to get together for Thanksgiving and Christmas. This was a hard holiday season for me too. It was just my husband and I for, Thanksgiving, Christmas, and finally Anuja said, well, it's me again. I hope that's good.
So I think it's time that we move on from the signing up process. I am certain there are people on the call who still have questions, and I'm sorry if we can't just really cover it more. I hope I sort of crystallized most of the questions into the questions that I've asked you now, but I would encourage everyone to check out that page that you mentioned on the Brookfield ct.gov site, so they can have that help. And if they need more help, if they can somehow communicate that, or I can pass on questions to you, maybe there's an additional FAQ or an additional piece of information.
Can I just tell you the easiest thing that you could do if you're struggling with making an appointment is phone a friend or phone your family. Honestly, because phone your grandchild. If you have a teenage grandson or granddaughter, they can do that so quickly. Once you have your link. Once you have the email appointment. We are working really hard. I've had volunteers calling people to straighten out the duplicate email problem that we've been having, and we'll be calling even next week for some of those, because we've only gotten through the 75. Now we have to get through the 65.
Right. So I would say that for the people on the call who are over 75, who signed up with the town of Brookfield whenever they did it, and they never received confirmation or whatever, by this point, they should have received a link to register in VAMS, or hopefully received a call from you that they need another email address.
Right. That's what we're trying to do. Yes. By next week, we will have all the calls made. Okay. And we will be holding clinics in Brookfield, and we will be holding clinics until we get until we get our community vaccinated. And by the way, 80% of the Brookfield community is 14,000 people. It's a lot of vaccine, right? And we're a small town compared to most towns. The city of Danbury is 85,000 people. So just Greater Danbury, I mean, I think Newtown is like 25 or 30,000 people. So just think about what those numbers look like, what that means, right? There's a lot of people that need vaccines.
Sure. Okay, so let's move on now to the administration of the vaccines. And there are a lot of questions about that. I'll just start with some specific ones. We can get a little more general, a little more bigger picture. But will vaccines be given in Brookfield? Are there vaccines now being offered? Can people make an appointment in Brookfield, or is it all out of town?
Okay, so when you get your VAMS link and you get to the point of scheduling an appointment, I want you to know that you can put in the distance that you want to travel for an appointment, and you can look for clinics anywhere in the state. Right. So you can look for a clinic. You don't have to only go to a Brookfield clinic. You could go to Danbury Hospital, their vaccine clinic. You could go to a vaccine clinic at New Milford Hospital, or you can go to a vaccine clinic that might be held in Danbury. But Brookfield, now I want to remind you, Brookfield is we have a part-time health department. So the vaccine program. This is a project that I'm working on. It's not like, we have a bunch of hired nurses that are ready just to go out and, give vaccines. We're building the program, and we have to build the program. And so let me just tell you about the unbelievable response that we had to this call of action. So I want to say it was maybe the end of November, around Thanksgiving time, Dr. Sullivan put out, maybe it was in the code red. It was probably in Steve Dunn's code red, but Dr. Sullivan put out a request for community service volunteers that are health professionals that have a background in nursing, or doctors, physician assistants, people that are emergency medical. They put out for this call of action, and we put a seamless document on the portal for that as well. We had an overwhelming response to that call of action. And I am if I could tell you how proud I am to know how many, recently retired doctors and nurses that still have active licenses that are coming out of retirement to help with this initiative in town. In addition to that, we have people who are actively working full time and still want to help with this initiative in town. And so we have, like I said, doctors and nurses that are like, tell me when you're ready, I'll be there. So we're building those vaccine clinics, and our first vaccine clinic, which you have to have an appointment for. There are no walk-ins, and there are, you can't do a phone call to get an appointment. You have to do the appointment through VAMS, and you'll see Brookfield on there, when you go to make an appointment. But our first vaccine clinic is Thursday, Thursday, the 21st. I love the date, 1-2-1-2-1. It's a pretty cool date. Yeah, I'll probably never forget it. So it's January 21st, 21 is our first vaccine clinic. And the time slots are available in VAMS to schedule that appointment. And it's open now. We opened it at 3:00 today for people to see those appointments. And we're hoping that we gave enough time for Brookfield residents to get in there and sign up. But that being said, we're having another clinic on Friday, January 22nd, 21. Not quite the same cool number, but that's on Friday. And then we're planning to get more vaccine doses. So we can only schedule our clinics with as much vaccine as we can get. So we're trying to get the same number of doses for the next week. So we'll do another clinic on Thursday and Friday.
I'm sorry if you said this and I missed it, but where is the clinic in Brookfield? What's the location?
The clinic in Brookfield is going to be at the Brookfield Senior Center, because we want our 75 and older adults to feel comfortable going to a place that they know. So it's going to be at the Brookfield Senior Center. But again, I'm going to reiterate that there are no walk-ins, and you cannot call and make an appointment. You have to do it through the VAMS administration management system, because that is what the federal government has designed for us to use to give people access to the vaccine. So we have to learn and follow a process too.
I received one question that I was sort of going to wait till the end to do some more specific questions, but it's right on this topic. And I thought it was an interesting question. And it was that, indoor environments pose the greatest risk of exposure to COVID-19. Were there any plans for distributing the vaccine in a safer outdoor setting, like a drive-through or something like that? I thought that was an interesting question.
Yeah, we're not prepared at this time to do a drive-through, because that, I think, could be difficult. But what we are doing is the appointments will be scheduled so that we're not exceeding room capacity as people are going through and getting their vaccines. And when you're doing your 15-minute monitoring, you're going to be wearing a mask. Everybody has to wear a mask. Don't come to an appointment without a mask on. And you'll be the chairs will be placed in a socially distant fashion so that you're not near anybody.
The other question that I'll just bring up now that someone posed was a concern about, older, frail, potentially frail, or, people with underlying conditions, having to stand and wait in line to get their vaccine. They were concerned. They wanted to know if there was anything being done to ensure that, when you show up for your appointment time, it's more or less the right time. I think probably echoes of
Well,
what was
that's one of
happening
the
in
things that
Florida.
I want to make it an important factor about. We know that people get excited and are going to try to come early. If you have an appointment, please don't come, an hour before. It's in town, it's in Brookfield. Most people live within 7 minutes of the Brookfield Senior Center. So it's okay to get there 10 to 15 minutes before and wait. But if everybody comes 2 hours early, first of all, the parking lot will be overfilled. And secondly, there'll be a lot of people waiting for no reason. Just come close to your appointment time. I also want to mention something about coming to your appointment. Also think about what you need to be wearing when you're going to get a vaccine. The vaccine is going to go in your arm, in the muscle in your arm. So if you have a ton of layers to take off, you want to think about that. When I went, I'm recommending that you wear like a sleeveless shirt and maybe put a cardigan over it. So then you just have to do one of these, right? You just need to slip the sweater down. Think about that. You don't want to be undressing to get your vaccine. So dress appropriately. Secondly, I want to remind, one of the things I'm going to mention is that 24 hours or the day before your appointment, you're going to get a reminder through CDC VAMS. You have your appointment tomorrow, but you need to fill out this online medical screening. So 24 hours before your appointment, you're going to get this medical screening and you have to go on and do that. And if you don't do that, and then you come to the senior center for your appointment and you go, I have an appointment at this time. We're going to say we need to have that medical screening because we're going to have another roadblock that we have to figure out. So it's about going on to your computer and looking at that same email and seeing if the CDC sent you something the day before your appointment, and you answer those questions online. So if you're helping a senior do this, please help them with that 24 hours before.
Yeah, that's an important thing to know for the people who are helping, that, otherwise no one will be looking for that email.
Right.
If the person with the appointment doesn't.
But it's in my steps. It's in my steps. It's in my steps.
Good,
to
okay, good.
It's in my steps. I included that.
Good. Okay, so do have a bunch more questions quickly. Second dose questions. When do you sign up for the second dose? Will someone be monitoring the interval so that you need to get it by a certain time, or is the person responsible for his or her own monitoring of the time? Do you have to get it at the same site? How will the administrator of the second dose know which vaccine you had for the first dose?
Rachel, that is a really great question. That's a very important question, actually. So you definitely, when you go to your appointment, you're going to get this fact sheet that's going to tell you what vaccine you got. You got the Moderna vaccine or you got the Pfizer vaccine. Now I'm going to tell you that if you're at a community vaccine clinic, something that's held like at the Brookfield Senior Center, it's likely that you're going to have the Moderna vaccine. The health departments, local health departments only really have the capacity to store at regular freezer temperatures and refrigeration temperatures. The Pfizer vaccine requires such a cold temperature. I think it's like minus 90 degrees for storage. And because it has such requirement for storage, the Pfizer vaccine is not really realistic for a local community vaccination clinic. But certainly a health system like Nuvance or a health system like Hartford Health or Yale, where they have the big capacity to store things at cold temperatures, they may have both vaccines there, right? But your local clinics will likely have the Moderna vaccine. Now, after you get your vaccine, you're going to get a vaccine card, and it's going to tell you the day you got your vaccine, the time you got your vaccine, what vaccine you got. And it's going to give you an idea when you should schedule your next appointment. So you're going to go like, I remember you used to get vaccine cards when you were a kid, right? You're going to get one of those handwritten cards by the nurse who administers your vaccine, right? So you're going to get that card. So that's also going to give you an idea of when you make your next appointment. Now, if you're getting the Moderna vaccine, your appointment should be 28 days later. So about a month later, you make your second appointment. You make your second appointment by going back to the same link that you had. So don't delete that email. That link is in that email. You go back to the same link. And now you can go in and say, okay, now I'm going to schedule an appointment for a second dose. Okay. And it is recommended that you go back to the same location where you had your first dose, because then you'll know that you'll get the same vaccine, right? You don't have to, but it's recommended, because I noticed when they deliver our supplies, like we'll order the vaccine supplies, and then they'll say your second dose vaccines will be automatic. So we won't, you know what I mean? They'll know that a month from now, we have to administer 200 second doses, right? So so there's a system in place where the second dose is going to be automatic. So it's helpful to reschedule back where you had your first appointment. It's a learning curve. We're going to try to see if we can make some of those second appointments during that monitoring period. But I'm not sure how that's going to, I'm still trying to figure out how that will work. But I certainly do know that after your first appointment, you can go back to your link and make your second appointment.
Is there anything any record that's being kept at the facility or at the administration site, like for people who, for whatever reason, it's just not reliable that they're going to hold on to that sheet of paper, or it's just not reliable that they're going to keep that immunization card, and they're not going to know the difference between, there's got to be cases.
That's a great, Rachel, thank you for asking that question. So the whole reason why everything is in VAMS is because it's electronic record, and we will know what vaccine you had and when you had it, so that you cannot get administered the vaccine too soon, and you cannot be administered the wrong second dose. And that's really the role of this vaccine administration management system, is to help you make sure you get the right dosage and the right type, because you do want your first and second vaccine to be the same type. So if you have Moderna for the first dose, you want Moderna for the second dose. If you had Pfizer for the first dose, you want Pfizer for the second dose. Thank you for asking that question.
Oh,
You're
sure.
so good.
The next question, I have two more questions that are probably, well, actually, you know what, before I get to those, I skipped over one, which is about the different states. If you live in Connecticut, do you have to get your vaccine in Connecticut? I received several variations on this question from people who have, so, and I wouldn't mind actually.
I think specifically, I think that might be a question I have to go back and ask at a different level than me. I believe that it's quite possible that you can get the vaccine in a different state, but you'd have to make an appointment. And I'm not sure that you can view appointments in VAMS outside of Connecticut if you live in Connecticut. Like, I don't know how extensive they'll let, you can put in the mileage for a clinic, right? Because New Jersey is 100 miles away or 200 miles away, right? Can I go to New Jersey to a vaccine clinic? I don't know. So I'm going to have to that's a question I'm going to have to go back and look at, and we'll put that in the FAQs. I think if you're living with a child in another state, that's different. Then you're going to go and get both your vaccines in the state that you're living in, even if your house is in a different place.
So those were some of the specific questions that I received, and I wanted to bring that up, and we'll just bring it up now. For example, someone whose mother lives in Florida, who's been staying with them in Brookfield through this pandemic, or
then they get their vaccine in Brookfield. Yeah. So if you're caregiving for your parent and they're living with you and they're in Brookfield, you're gonna register them on the Brookfield Town website, and they're gonna get their vaccines in Brookfield.
Okay, so they're not going to.
You're not going to fly them to Florida to get a vaccine, for God's sakes. No, we're not going to do that. If they're living with you, then you're going to be taking them to their appointment. You're going to want that to be in Brookfield, not Florida.
Sure. I think I'm guessing, and I don't know, but I'm guessing that their thought is, maybe their driver's license or their ID says they're a resident of another state. Is that
Yeah,
going to cause any impediment when they get to their
I, I
registration?
mean, I will put specifics in the frequently asked question, but I highly doubt that they're going, especially in this over 75 group, how can they do that? Because so many people are caregiving for their parents.
Another question on this was, I'm not going to look for it because it's in a stack of papers, but it's basically someone works, I think they teach in New York, but they live in Connecticut. And then I think it gets a little more complex if it's based on your work, right? If you're qualifying for a vaccine because
Oh,
you're
yeah, I know what you're saying.
a worker
Yes.
in New York,
Well,
but your residence is
right,
in Connecticut,
right,
how does that
right.
work?
So yeah, that's true. That's a really good question. So in Brookfield, there is a person at like the school district, for example, because they're frontline workers, right? So if you're a teacher in Brookfield, when that phase is rolled out, the Brookfield school, the person who's been appointed to put those people into the VAM system, will be a Brookfield person. So if you live in New York and you're a teacher, it's probably gonna be the place where you work that enrolls you into the system.
And that's going to be only the case with the sort of the frontline work or essential
I
workers.
think so. I think it's going to go with because remember, it's the employer or organization. So I think it'll be going with your employer at that point.
Okay.
Just like if you work for Brookfield Town Hall, right? When it becomes time, or if you, yeah, it'll be rolled up with your employer.
Okay. Um,
And I think at that point, I think if you live in Brookfield and work in New York, but you have an appointment, you can still make an appointment in Brookfield. You'll just get your invite from your employer,
oh,
right?
that's
Right? Your employer will load your name into VAMS, but then if you want to get it in because you live in Brookfield and that's where you want to go, or you want to go to Danbury Hospital, you just pick that as your location.
okay. So it's not, I mean, because the different states are getting different shipments of vaccine that are
Yeah.
allocated to that
I
state.
mean, that's a really complicated question, but I don't think there's going to be any way to say, oh no, we know you work in New York State. Nope, you can't go to Danbury Hot. No, I don't think there's any way that they're going to be able to do that. So I think you'll see when you get into the VAMS portal that, you can search clinics of where all the clinics are. And you can, if you want to drive 25 miles because you can get an appointment tomorrow, you can do that.
Right. Though I would say, I do want to say about that, because this came up when I was scheduling for my mother. If you are recommending, and it is recommended, that you go to the same site for the second dose, and you are choosing to go far for the first dose, then just keep in mind that you'll need to go far for the second.
Right.
It's recommended that you go far for the second dose as well.
Right.
It's something to keep in mind. If it's a difference of
Good
a
point.
week or a few days, you might want to weigh that when you're picking your site.
Very good point.
So the other two questions quickly on the the administration are unanswerable questions, but I'll pose them because they're important questions to ask. And one is, can people be confident that there will be enough doses available for the second dose when it's their time to get one?
Well, I think I mentioned before that when we're ordering the vaccine, we order what we're putting in an order, and it has to be approved. So there's all these metrics that you have to meet. It has to be approved. You get approved for the order, but if you get approved for 200 doses of the first dose, of the first dose, they say you're automatically going to be sent your second dose appointment. So we'll be automatically sent those. So
That's an assumption.
it's an assumption that yes, there will be 2 doses available for you. That's the goal. That's the goal, because that's what the efficacy shows. 2 doses, 28 days apart.
I just think that people have concerns about supply. They have concerns about competence. They have concerns about a lot of things.
Well, I mean, it's been really, I'll be honest, it's been a rough year. It's been a very difficult year, and I understand that. But I can tell you that of the public health people that I've worked with for the last 10 years, and I've worked with, multiple public health leaders and directors in our community on multiple projects. And I can tell you that every single one of them is a leader and they are determined to do the best for their community.
I by no means felt
Yeah.
meant to say
But
there was
I
anyone
just want
local
to say,
incompetent.
I
I
just
meant
want to
on
say
a
from a
federal
trust
level.
point of view is that, the local health departments are doing their best to do what they can for the residents that they serve.
Of course.
And there is a lot of media, and sometimes the media is what gets us so confused, is that, especially if you're listening to different news channels, and then you're like, well, they're saying this and they're saying this and they're saying this. It gets overwhelming, on top of the fact that we have loved ones that are dealing with this virus, and we're like, I just want to get this done and over with.
Sure.
So.
Yeah, it's out there. It's a legitimate question, and especially if there are changes in how many doses are released, then there's supply issues. So just
Oh yeah, but I think I mentioned that the supply is produced by our pharmaceutical companies, right? Funded through our federal government, dispersed to the states, and then the states have to make allocations to the towns, the town health departments. So yeah, I mean, it is going to be affected by what gets produced at the top level.
Sure.
Right?
Of course.
And how much money is put into that and how much money does the government, budget for it?
Sure. So, and then the other one was, when do you expect we may see a time where vaccines are given at places like CVS or at our doctor's office? At what point do you think we'll get there, that we're not going to clinics, and that it's not, is that like phase 1C? Is that phase, 2?
I think that's gonna be a future phase. I don't think it's gonna happen in the next few months. I think I would love it to happen by, April, May, but I don't have a crystal ball. I really can't predict. I can only guess. And, but that's why it's important to go to those web pages and watch and see when those phases are rolling out. But I do think, just like the flu vaccine is available in our local pharmacies, the COVID-19 vaccine will be available in pharmacies down the road, but probably not for a few months.
Okay.
And same thing with, perhaps some of our doctors' offices, and, and I believe the hospitals will be running ongoing clinics. They're not going to stop until the community is vaccinated, because they have a big stake in that, because they don't want people in the hospital with what's going on right now. So they have a big stake in making sure people get vaccinated.
So I think, because we've been talking for so long, we'll move on from the administration, even though there are certainly still questions, but hopefully we covered a lot. And so next sort of category is after the vaccine. So after someone receives both vaccine doses, will they still need to wear masks and practice social distancing? Can they still get the virus? And can they still transmit the virus to other people?
So I can't answer all of those questions, because I don't know the answers to all of them, but I can answer some of them. So after you get the vaccine, you have 2 doses of the vaccine. What the efficacy shows, and efficacy means the research, the clinical studies that have been done about this vaccine. I've heard that they're 94, 95% effective at preventing the coronavirus, like building the antibodies against the coronavirus. So I saw some research that said their goal was to be better than 86%, and they hit 94 or 95. So they actually are working better than they set their goal for. So I think that's a good sign. And will you still have to wear masks? Well, remember, I told you, just in Brookfield alone, there's 17,000 residents, right? And I also mentioned before that we got to get 80% of them vaccinated. That's 14,000 residents to really have the vaccine have its best, be most effective. That's just Brookfield. What about Danbury? What about Newtown? What about the state of Connecticut? What about the 52 states? So it's really going to be about everybody working together to tackle this virus. And so while we're getting everybody vaccinated, the question about having to social distance and wearing masks, yes, we will have to continue with social distancing and wearing masks until it is determined that there's a decline in the number of cases of COVID-19. and you asked a question about, will I be infectious if, like, maybe I won't get sick from the virus, but can I get somebody else sick from the virus? Getting the vaccination will not get you sick nor anybody else sick, unless you catch the virus. Like, you could still potentially, if you just got the vaccine and then come in contact with someone who had COVID-19, you can still get COVID-19.
Oh, just to be clear, I did not mean to imply that the vaccine will give you COVID-19. I know that that is not true. I mean that my understanding was that you can still get the virus after you've been vaccinated. You just don't get sick. Is that accurate? And that
I don't know. I don't really know I can't really, I have to really think about how to respond to that question, because as I said, they're saying it's 95% effective, of preventing the COVID-19 virus. So, I really need to look at what is that language? What does that language really say? The reason why you still are going to have to mask and social distance is because as a community, we have to support each other while everybody is getting vaccinated, right? And what are we going to do? Wear a badge? I was vaccinated, I don't need to wear a mask. Like, let's just be kind to everybody and do the right thing and say, you know what, until everybody is vaccinated, I'm going to do the right thing, and I'm going to wear my mask. I'm going to practice social distance, the things that need to happen. Right. So, it's going to be still important to do that after a vaccine.
Okay.
And yeah.
So I think, someone asked specifically if they are vaccinated and the members, the people in their home are not. Could they still potentially be infectious? And again, I think it's because there's an understanding, perhaps an erroneous understanding, that you can still get the virus. It just doesn't progress. So you can still have it. But if that is not, that's
the question I really don't know the answer to. And I don't even know that it's been researched yet. We just started vaccinating people. So how do we really know?
Mm-hmm.
Right? How do we really know? So, that information is going to be forthcoming. And I don't think I can credibly answer that question.
Okay, thank you. So then how many people do you think need to be vaccinated before we start to see an impact on case numbers, an impact on hospitalizations? Is it like 80%? I mean, do you have any thoughts?
I mean, I'm saying it's got to be 80%. That's my goal. We got to get 80% of our town vaccinated. That's what they're saying. 80 to 85%. That's a big number. Yeah. And so it's going to take time to get there.
And if someone who you love, who's 75 or who has an underlying medical condition, gets their vaccine, gets their second dose, can you go see them? Do they have to wear a mask? Do you have to wear a mask? What happens then? Are they considered? Should you consider? And again, I know that we should, as a public health issue, we need to continue to have social distance and masking. But on that sort of very personal level, like really wanting to see someone, at what point can we say, you know what, I can give you a hug? That kind
the
of.
New York Times on Monday. So one of my volunteers, she's one of our contact tracers, just an amazing woman who reads everything. She's so knowledgeable. And she sent a link out to all the other contact tracers, and it was life after you get the vaccine, and it was in the New York Times. And I've had it on my desk all week to read, and I still have yet to read it. And so, I think they're just starting to talk about that and what that's going to be like. And because we're just starting the vaccine program, I don't really know that they have all that information. But if I had an elderly parent, I would, at this point in time, because the COVID rates are so high, I would be very, very careful about visiting my parent, and I would still practice all of the measures until someone told me for sure that it was safe to, to visit them in any other way.
Thank you. So I think, just in the interest of not ruining everybody's, not
Friday night,
making their Friday night wonderful, I'm sure, but I don't want to take up the entire night. I think we've covered a lot of stuff. Oh, no, one more question. I'm sorry. I really do want to ask before we do the sort of where to get information, kind of a wrap up. Will we need to get new vaccine shots every year? like the flu vaccine, or will the current batch protect us for longer? Do we know yet? When will we know?
We don't know yet. We don't know yet. I mean,
Will we know just if
hopefully,
it,
I think we just have to stay on top and just watch the research, watch what they're telling us. They're collecting data. There are, there's going to be an app that you're going to be invited to use after you get your vaccine. And then you get like a little text message that takes like 5 seconds to do. It's called vSafe. And this is helping that our researchers understand what are the adverse reactions to the vaccines, what are the long-term impacts of the vaccines. It's called vSafe. It's something you can put on your phone. Again, another technology thing, but I did it because I'm like, this takes me like 5 seconds to do, and I'm contributing to research. So.
okay, so I think that, again, I do want to thank everyone who submitted questions, and there were so many wonderful questions. And I hope that we got at the underlying issues, which a lot of them were: how do I sign up? How do I, when do I sign up? Did I sign up? I just sent something and never heard back. So I hope that a lot of those were answered. I'm certain that there are people whose questions were not answered, and I apologize. And hopefully the FAQs will, on the town website will be helpful. But I did want to close out with sort of, where to get information. Where do you want people to go to get the best, most up-to-date information on what is a very fluid situation that changes all the time? So where do you want people to go?
Okay, I'm going to share. I'm going to see if I can go back to this one, the Connecticut COVID-19 response. That's going to be up. That's going to be up to date. That's where you're going to see what Governor Lamont, his announcements are going to be there, what the public health department, what all of their goals and what they're planning to do. So this is what the state is doing. So if you go here to Connecticut COVID response, now we're going to take information that we learn from Connecticut COVID response, and we're going to put it on the town website. So if you want what's going on in Brookfield about the vaccines, go to the town website, sign up for the first selectman's code red alert, because right now his code red alerts almost every week have up-to-date information on the COVID-19 vaccine in COVID-19 pandemic in Brookfield. So sign up for his code red. And so that alert will come to your email. So I'd recommend that, the state of Connecticut website, because that's how you're going to know what the state is doing. And then, you can, like I said, I found a really good program an interview with Dr. Fauci. He wasn't as long as me. He was really good, but really good interview with him. And he gave a lot of great information about the vaccines and why the amount of time that they've been studied. Like, he really went into detail about how much research went into these vaccines. So.
Okay, and if someone has a question, don't call the health department.
I can tell you
want to say that.
Today was a really hard day. We had volunteers answering phones. We had all the senior center staff answering phones, the health department staff answering phones. The first selectman was answering phones. So it was a really rough day today, because, it was the first day that the appointments opened up, and people were anxious and they want to know that they're going to get it. And we are working through the process. We have a process. We're working through it. Is it perfect? No, but we're working on it. We're finding ways to fix it. And if we have to have volunteers make phone calls so that we can have a unique email for each individual we enroll, then that's what we'll do.
Well, I think that it's a really great opportunity that people have had to be able to hear from you. I think people get, it's been a confusing process and a hard process, and not having a person to talk to or hear from to get an answer is difficult. So I think that this was a great opportunity. Right. And I thank you very much for your willingness to participate.
Yeah, I'm more than happy to do that. I love Brookfield and all the people that are here. You know, I've been here a long time. It's a great town and it's a great community, and we have wonderful volunteers, and we have a really hardworking part-time health department. So, you know, I think they're doing a really great job, and you know, I'm happy to be working with them on these two special projects of contact tracing and the vaccine administration, and just happy to share what I know. And if down the road you want me to come back on again, or maybe you don't because I'm too long, I don't know. But but if you want, if this is helpful, then I'm glad to do it again if it helps people to understand the process. But we are really working hard, and we're doing our best to make sure that everybody that's a resident in Brookfield who wants a vaccine will get a vaccine. The hardest part for us is, you know, getting the order, like getting all the background stuff done so that we can get to these clinics.
Well, I think that the town is lucky to have you working on their behalf, and you and the rest of the health department. So, and I think that I can say definitely we'd be very happy to have another talk with you as more information comes out. So I hope we can set that up.
Well, thank you, Rachel. You're a great moderator.
Oh, thank you. I'll take it. Okay, well, thank you so much to everyone who's been listening. And as, of course, very special thank you to Maureen, Farrell, for giving us so much good information tonight. So,
and remember, if you're struggling with an appointment, phone a friend or phone your family. Make that call.